I am Chad. I am Chad Allgood. I am one of the co-directors of the division. Um, I'll go ahead and introduce some of the other folks that I've got with me here today. I've got Laura Dixon, who is one of the deputy directors of the division, and Laura is also our policy director. Angela Crockett, who is also a deputy director of the division, and Angela oversees the child care payment program. I've also got Ashley Roper with us, who is our project coordinator for the division. I think that's everybody from my shop that's on here. Yeah. So again, we welcome everybody. I'm going to give everyone just a minute to log in if they need to log in, and then we will get started. Just as a reminder, the way that this goes, we will give just a few updates
See if I
from.
got it right.
We will
Is that
give.
right?
We will give everyone the opportunity to ask questions. First, we're going to give some updates from the division, and we'll give everyone an opportunity to ask questions. I will say, if you do have questions that are very specific to your program, like your ledger, like something specifically going on with yours, if you instead of addressing those questions here, if you'll send an email to the CC Payments email, we can get you a better response. We will answer any general questions about completing ledgers and things like that if you do have any of those. So give everyone just another moment to get logged in. I don't have my video up because we're going to leave some reminders up on the screen just as people enter the meeting, just so we're not repeating ourselves over and over and over. If y'all can hear me okay, can y'all just say okay in the chat box if you can hear me? Okay. All right, good deal. All right, good. Looks like I'm not having any hearing issues, so that's good. Okay, we'll go ahead and get started. I'll get what I'm going to do is I'm just going to start out, give you a few updates about what's going on here, and then we'll give you all some time to ask questions. So the first thing that I wanted to mention, I've received some emails from some folks about continuing support for child care providers, similarly to what we did with CARES Act funding. We are still waiting to receive our notice of award for the Consolidated Appropriations Act. We are going to be getting some additional funding from the feds. We're waiting to actually receive that award. I have been checking with our budgets division every single day. I know they're getting tired of me because I email them every single day asking if we've received any notification. Yesterday I did speak with our federal partners and just to kind of get an update. I don't know what happened, Laura. The screen went away. Okay. All right. There we go. As I was saying, I did speak with our federal partners yesterday to try to get an update on where the notice of award was. And Region 4, Mississippi is part of Region 4. So the Region 4 office, they told me they just received notification on Friday. So we should be receiving notice. What I was told was any day now. As soon as we do receive that notice of award, we're going to, shortly after we receive that notification, we are going to pull together the task force, the COVID task force that has been meeting since the beginning of the pandemic. We're going to talk to them about some of the about what our plans, what we're looking at, get some feedback from them on what you all want, what might work better, and we're gonna offer you as much help as we can. Um, I can say, and this is not definite because again, we want to talk to the task force to determine what's been most effective. We are going to look at, hopefully resuming those same support programs that we put in place using the CARES Act dollar or similar to what we used with the CARES Act dollars. We're going to try to put those back in place, which includes, the enrollment-based reimbursement, the enhanced rate, which we are continuing to pay the enhanced rate at least through March. And hopefully we're going to have that notice of award, like I said, in the next few days. So we'll be able to continue that. And then also covering parent co-payments. In regard to co-payments, we did cease covering parent co-payments effective January 1. So you all should be collecting co-payments beginning January 1. And you need to continue to do so until you receive notification from us. We are going to tell you the exact date that we will resume covering parent co-payments, and it will be at the beginning of the month. And we'll let you know that, whatever that date is, for example, if it's March 1 that we start covering parent co-payments again, you would not need to collect co-payments for March, and we'll let you know as soon as we do start doing that again, if that's one of the support pieces that we do put in place. I will say, just based on feedback, I think that those three things were very effective for you all in the past few months, and we've received a lot of feedback that some feedback from you all that those have been helpful. And so I know, we will probably be presenting those to the task force, and then anything additional that we can do, we'll be talking about that. So continue. So you should be collecting parent co-payments effective January 1. There was also, Laura, can you put the next bullet point up there? Thank you. Yeah, notices for parents for parent redetermination, they began going out February 1st. At this point, redetermination is back in place. And we did this for a variety of reasons. We just could not continue we couldn't continue not having redetermination in place. So we did put parent redetermination back in place, and it will continue in place for the foreseeable future. We've also gotten some questions. I think the next one's about health and safety. Is that right, Laura? Right. So the DECCD required health and safety training, and that's what's required for the standard center designation. It is going to be offered it's going to begin being offered by the Mississippi Department of Health. We're going to, the training has been revamped. We've tried to create something that's going to be a little bit more meaningful to you and your staff, and be looking for notification from us. We will send an email out to everyone on how to register for that training. The other thing that I was going to mention is if you, in the meantime, if you do need other training, we still have the resource and referral sites. They are still offering training. The Mississippi Early Childhood Inclusion Center through USM, they are continuing to offer training, and they have actually expanded what they're offering. They're offering more training now. So both the R&Rs and The Mississippi Early Childhood Inclusion Center are very good sources for free training. And then, of course, the Department of Health is continuing to offer training as well. And as I understand it, they have also extended what they offer in terms of topics and other trainings that you can take besides just the regulation training. We've also gotten some questions about the director's credential. We are in process of getting it back in place. Right now, the curriculum has been updated. What we're doing right now is just trying to figure out the best way to go about delivering it. With the director's credential, y'all know it's a pretty intensive program, and it is a pretty intensive program. So we want to make sure that the way we can offer it is going to be helpful and beneficial to everyone. We don't want to hurry that to put it in place, but we are in fact working on getting the full Mississippi director's credential back in place. For those of you that don't know what the director's credential is, it's a course that is specifically geared for those that work in administration of early childhood. And it's been offered for many, many years. Back in 2016, it was discontinued, but we are trying to bring it back. One other piece of good news that I'm going to share with you, we are really, really close to getting direct deposit ready to offer. We're working through that process right now. Hopefully, pretty soon I'll be able to announce to you all that that will be an option for you to take advantage. So, don't have to worry about paper checks coming in the mail or checks being missed. Hopefully that will make it easier on you all on the business side of things. So that's all I have in the way of updates. Angela, Laura, do y'all have anything you want to mention to anybody before we open it up for questions?
I do, Chad.
Okay.
Just in general, I think everybody noticed that there was a change on your ledgers for the month of January. On the first day that you went in for ledgers, it was giving you some issues where you were having to put information in for your preschool students. So that error has been corrected. So you only have to put in a code or answer the question. It really is an override code to just help you be reminded that for your after school students that you are putting full time in at this time when we're not paying for full time care. So it's just a override. So if it doesn't apply, then just go ahead and skip that, and then and it'll allow you to put your ledger in. But we fixed the error so that it only applies to school age children. Okay, because that was the whole intent, not for your preschoolers. So you should see that. Okay, I'll go to the first question. It looks like it's from Miss Hanson. I can't
All
hear
right.
you.
Well, we'll go ahead and we'll open it up for questions. Just as a reminder, if you'll put your questions in the chat, Laura is looking at is going to be monitoring the chats, and she's going to moderate. So if you have questions, go ahead and put those in the chat, and we'll open it up. We'll open it up for questions. Oh yeah, really quick before we get started, let me pull this up just one moment. So the Mississippi Low Income Child Care Initiative, they are hosting a webinar, and it's going to be on Thursday, February 4th at 1 o'clock. And Carol, we'll send that out to we'll send that out on our email listserv. We'll send that out this afternoon. But they're hosting a webinar, and the webinar is specifically about the second round for the payment protection program, and the economic injury disaster loans. Make sure, if you can, to attend this webinar. I think that they're going to be sharing I think they're going to be sharing some really good information with you all. So if you can, take advantage of that. And Carol, we do really appreciate you and Maliki offering that additional support to everyone. That's fantastic.
Ready, Chad? I'm going to read the questions for Laura.
Okay.
The first question is, how much is the allocation for 2020-21 from the state?
Let me look what we did receive. We were able to receive a good bit more funding than our CARES Act. We don't know so we don't have the actual notice of award just yet. We do anticipate it to be somewhere around 130 something million, give or take. I think I want to say 136, but give me just a minute. Let me pull that number up. Yeah, so Mississippi is estimated to get 136 million, well, right at 137 million estimated. Again, we'll know for sure what the full award is when we do receive that notification from the feds, but that is the anticipated amount. We're excited about it being that much. We think that we're going to be able to offer you all some really good support with that funding to help you through the rest of this pandemic. We do have the vaccinations are out, people are getting vaccinated, but of course we still got a ways to go. We're not out of the woods just yet.
I'm sorry to interrupt. Can you just verify that the budget amount that you just named was for the new Appropriations Act, correct?
That's correct. So the
I think
136.
the question was actually how much is the allocation for the 2020 to 2021 from the state? I don't know if that's like just our normal fiscal award that they're asking for.
Yeah, I'm not sure about what that means for what the question is. If we could get some clarification on specifically what amount we're talking about. Go ahead, Angela. If that person could just clarify if I didn't answer their question.
Okay. For parents who are working but their hours are less than 25 hours, will they lose their certificate? I can answer that question. Basically, the rules for the program is 25 hours per week to be eligible for the program, or in school full-time, or a combination of part-time school and part-time work. So they would need to meet that eligibility at that time if they get selected during this period for redetermination. So they will need to meet the requirements in order to maintain their certificate. The next question said, so on the last meeting, we were told that we should only collect co-payments for January because May of the areas have not received notification from your office. We've received a lot of negative feedback from many parents. Will you be notifying them about payment? We can send out a notice letting parents know that co-pays will stay the same. They will be responsible for co-pays until further notice. The next question. What about the children who have turned 5 after September 3rd? I'm not understanding. Can you be? Are you saying that if the children are at your center all day long and they're 5? That and they're not in school? And those children will be considered full-time if they're at your center all day and are not eligible to go to elementary school. The next question is, when you receive the COVID appropriations, will you suspend redetermination again and make it so that parents do not have to pay copay fees?
In terms of the suspending redetermination, I'm not prepared to answer that just yet. We're gonna have to look at, we're gonna have to look more into the details of what the results of making that decision would be. That's a pretty large decision that I'm not prepared to answer on today's webinar. But we are going to be talking about that option. In terms of parent copays, I think that's been an effective program. I think you all have, appreciated the impact that relief has made both for parents and for you. It's a possibility that we will again begin covering copayments. But I'm not going to be making any official decisions until we have an opportunity to talk to the task force and get their feedback.
The next one, I'm not sure if it's a question or just a statement. It says that in the recent Consolidated Appropriation Act, it allows you to go back and pay.
Yeah, I believe that December 27th was the date. And I don't fully, I don't fully know what that's going to mean in terms of our program. But we have not received the official notice of award yet. I'm really not comfortable with us saying, I'm not really comfortable with us saying for sure what we are going to be doing until we do receive that notification of award.
If a child have used 5 days and out due to quarantine, will we get paid? If so, how do we mark it? If you have a child that's out for quarantine, you can use your DNR code for emergency, and you can claim the days that you need to claim for that. That's still an option for you, for your children who's out for COVID. Any question that's related specifically, you'll have to send that through email, or you can email me individually, but I can't answer those. This one says, why did you not consider retroactive payments to cover copay?
Say the question again, Angela. You said, why do we not consider retroactive
payments to cover copay?
It's not so much that we didn't consider it. It's really more that we didn't, we weren't aware of the new funding when we were planning for our CARES Act money. We said from the very beginning with our CARES Act funding that the way that we were going to use that funding, we would be covering parent copayments through December. And there was no guarantee, beyond that. But that was the plan, that through December, we would use that CARES funding. And we stated that multiple times on our webinars and in email notifications that we sent out. Now that we've received word that we have gotten this new funding, we're excited about the new funding, but just please be aware that, because we had gone ahead and made plans to, use our CARES Act money for co-payments through December, we did have a little bit of money left over where we decided we were going to use that for the enhanced rates. Because the funding, there was a lapse in time between December and then us finding out about the new funding. And like I said, we still have not received the notice of award from the feds. So I do understand that there has been a little bit of a break in, the funding, the additional funding support that we've offered, for like the co-payments. But we're doing, we're doing what we can to continue to support, child care programs. And I understand that, many of you are anxious about us continuing that support. I fully understand that. I can appreciate it. And I can promise you that we're being very watchful And as soon as we do receive that notice of award, we're going to take action to get you all that additional support as soon as possible.
The next question is, for school-age children, will you be paying the full-time enrollment?
Say that again, Angela. There was a little bit of feedback.
All right, hold on. For school-age children, which are full-time at the child care, will you pay full-time rates?
Is that in terms of like with the new funding, I'm assuming?
I didn't state, just.
Okay. In terms of the new funding, we're going to have to look at those estimates and determine whether or not we can, in fact, support that. I will tell you that the 3 support programs that we offer, or that we've been offering, which includes the enrollment-based reimbursement, covering parent co-payments, and paying at that enhanced rate, that runs us about an extra $10 million in addition to our normal, the normal certificate cost. So when you look at the math, if we continue that, I think there's a trade-off. Do we continue those 3 programs versus offering full support for school-age children? I will say we have about 30% of our children that are school age are, I think it's around 30% of the children that are served through our certificate program are currently school age children. So we're just going to have to look at the numbers on what that's going to cost us, which would include, what it would cost, per month to offer full-time reimbursement for the school age, how long we could sustain that. And we are going to pull together those numbers. We're going to present those numbers to the task force and see what their thoughts are. And, we can allow them to get some additional feedback from you all on how crucial that is. But again, we're just going to have to look at the numbers to know if that's going to be possible.
The next question is, will you all please send notice to parents regarding co-payments for February? And we will do that, okay? If the parent doesn't bring the child because they can't afford the co-pay, will those students be terminated? The parent is responsible for the co-payment inside the agreement that they have with us when they apply. If they are having trouble paying their co-payment, we would just need to know so that we could call and talk to the parent and see what they would want to do, because that is a requirement to be on the program. This one says, I have been anxiously waiting the passage of the $15 minimum wage. You just stated that as of now, we will receive the enhanced rates only through March. How will BECCD address the significant economic impact of a $15 minimum wage going forward with stimulus and, more importantly, beyond 2022? Can we invest in GameStop?
Can we invest in what?
GameStop.
That's probably a good idea. I wish we had jumped on the GameStop investment train, about a month ago. We'd be sitting fairly pretty, I think, at this point. With the passage of the minimum wage, so we're basically, if that comes into being, we're basically looking at that's going to double what teachers would be making. I know a lot of teachers in early childhood are making around minimum wage, maybe a little bit over. So we're talking about essentially doubling it. That's going to have a huge, significant impact economically, and that is definitely something that we're going to have to look at. Unfortunately, I can't give you a quick answer to that right now, other than if we look at making that, if that does in fact become the reality, that's going to require some very, very significant policy changes, not just on our end, but across the board. But that is a very good question. I think that's definitely something that's a discussion that we definitely need to continue. So yeah, and if it, you know, if anyone, if you have like any more, I know insider trading is illegal, but if you have any tips on some hot stocks that we could invest in, just let me know. That's a joke. DECCD doesn't invest in the stock market. That's just a joke. So
Okay. Do we use code DNR for the snow day? We do. You can use the DNR for the snow day, and that is an emergency code. But make sure you just in your comments, it's the weather. You know, closed due to weather. Then let's see. Are we accepting new applications for children? Our application is open for new children for our regular certificates. If an enrolled student doesn't regularly attend, will they be terminated? As long as they're in attendance at your center, no, they won't. The parent is still eligible for the program. So unless it's some reason why you would think they need to be terminated. I mean, if you think they're holding up a spot for your for someone else, you can request that they leave your center or to be terminated. But I think you need to talk with the parent and then go from there. But no, you just use the codes that's for attendance. The question is, can we allow parents to make arrangements if they cannot pay copay because they need to pay rent? As long as the parent pays the copayment, you know, for the month, I think it's left up to the provider to make sure that that's done, and as long as they meet the requirements of the program. So if you want to assist the parent in making sure that they're able to pay your copay during that time, I think that's a question that's up to you, as long as you have a written receipt that the parent has paid copayment for the month. I have 2 parents who applied and told applications are not being accepted at this time. They have been waiting for about 3 months. They are clicking the wrong application. Our regular parent application is open. The emergency certificate is the message that is giving out to parents if they click that one. So they need to go back in and click the parent application.
Angela, are you saying they're maybe clicking the emergency application?
Yeah, it's not a button there, so it's not available, but it's a notice up there, but they're looking at the wrong thing. Yeah. Now will we be paid for more than 5 days for students not attending because they choose for the child not to come due to COVID? If your center is open and the child is choosing not to come due to COVID, then you use the D and the R code. For clarity, is reimbursement based on enrollment or attendance? Enrollment. As I said earlier on the ledger, this question here is in regards to the ledger with the override. We've corrected the issue, so if you haven't been in the ledger since the first day, go back in. It has been updated. The ledger for full-time preschool students was asking you to do an override code for full-time. You do not have to do that anymore, so you should be able to go in without the override code. It only applies to the students that are in school age. And it's to help you know that you cannot claim full-time for a student, for school age students at this time. Are there any other questions? That was the last one, Chad.
Well, Angela, you did a lot of work for me, so I appreciate that. Give it just a minute if you have any other questions.
Just want to remind everybody that this session is being recorded. And if anybody needs to go back in and listen to any of the information that was shared before they were able to join our session today, it will be posted. We usually try to have them posted by the end of the week. So if you've missed a little bit of information today and want to go back in and hear any of the information that you've missed, or go back in and share this session with anyone else that was not able to attend today, check back on that website. Give us till Monday, because like I said, we usually takes us till the end of the week to get it done.
Someone put the last thing in here, Chad, about we really need emergency registration. Parents are getting jobs.
And that's noted. Again, you know, when we look at the way the funding, we will definitely, you know, we'll definitely take that into consideration.
Do we have a waiting list for child care payment program right now? The answer is no. We're processing applications, but there is no wait list.
And just make sure that the parents are going to the correct link for that. I will say we are also in the process of making our website. We're working on reformatting it to be a little bit more user friendly and easy to navigate. I know it's a little bit of a challenge right now.
The other question was, please repeat the answer for the method of reimbursement. We are paying by enrollment.
Hi, and just another reminder about the health and safety training. Again, it is going to be offered by the Department of Health coming up. Right now, until the Department of Health begins offering it, you can still contact your local resource and referral to get the health and safety training. And we will be sending out email notification when that process changes.
I'll address this question. It says, why is it taking so long to get on the program if there is no waiting list? We have a lot of applications that have come in through COVID, and we are working as quickly as we can to process applications. We do have a lot of parents who are sending in incomplete documentation. That information goes to the parents, not to the providers, so sometimes they might not tell you that we've worked their application. So we ask that you bear with us. We are working as quickly as we can to process applications to get them out to you if the parent is eligible for the program. We do see a lot of hiccups in documents and not enough hours, or the parents not eligible due to that. So just be mindful of that. But we are working nonstop to process applications to get them out there for you. And that was the last question.
We have any other questions coming in, Angela?
Let's see, it's one. I noticed that the co-payment was deducted from both siblings on the ledger, but I only charged the co-payment per family. Is that not correct? No, it's per child. You have a co-payment for each child.
Ms. Phyllis, I saw I just pulled up the chat. I saw your comment. We appreciate that. And I just want to say, we thank you all for everything that you all are doing. My gosh, the last several months, have been just extremely trying, and we just really do appreciate all of y'all's hard work. I know many of y'all are anxious about us getting that additional support to you. I promise we're going to get it to you as soon as we possibly can. If we don't have any other questions, we're going to go ahead and end the session. I know everybody's time is precious. We appreciate you all taking the time to join us today. We're going to continue. If you want to view this recorded session or any of the previous recorded sessions, they are all available at the same link where you registered for the session. We will be having another session coming up in March. Hopefully we'll be able to share some really good positive news. I hope you all stay safe, take care, and we will be in touch soon. Take care, everybody. Thank you.